We're talking Lyme disease. It is the great imitator. The great imitator of what? All your chronic diseases. It can be Parkinson's, it can be Alzheimer's, it can be MS, RA, psoriatic arthritis, ankylosing spondylitis, Crohn's, colitis, lupus, scleroderma. All these diseases can be caused simply by having Lyme disease. Now, Lyme disease testing is incredibly poor. 1 or up to 7 markers, and it has to be done within 3 days of having a tick on you. Otherwise, it evolves out its antigen structure, so you will not be able to see it on a traditional test. Now, Lyme disease was initially created as a bioweapon. Borrelia burgdorferi has been around forever. It's a spirochete. It looks very much like syphilis. It has a tail and spins around. And on Plum Island Animal Research Center, they were creating a vector-borne illness to try to work as a bioweapon. They manipulated Borrelia, they put it into ticks, and then they dropped it around 1972, they dropped it in Old Lyme, Connecticut, where it got the name Lyme disease. Now, that Lyme disease, they quickly found out they couldn't stop the spread of that vector. And that vector then went everywhere. People were getting infected with Lyme everywhere. It's horrible joint pain or incredible fatigue, and some people don't get a lot of those symptoms at all. Years down the road, they just end up with this chronic Lyme, where if you test it, they can't find it because it has to be within 3 days anyways. And if you do find Lyme within the 3-day marker, they give you doxycycline. Doxycycline is an antibiotic, and that's the gold standard for treating Lyme. Unfortunately, it cannot kill persister cells. This is not even controversial. Doxycycline cannot kill persister cells, which means that while it might decrease the overall symptoms you're having now, 6 months, a year down the road, you have a chronic disease. And when they test you again for Lyme, if they are willing to, they'll find negative. You don't have Lyme because, again, it's evolved out. You can, obviously, at our office, we do much more in-depth Lyme testing, 180 markers on 2 parts of your immune system, and it's definitive. With Lyme disease, traditional means do not cure Lyme. You will not see Lyme go away. We use something called TPS, Total Pathogen Support, on lifesupporthp.com. It has the studied dose or double the studied dose of every nutraceutical that works at least as effective as doxycycline for Lyme, plus it knocks out biofilm, plus it knocks out persister cells. We use that, and typically within 1.5 years to 2 years, we have full remission on all Lyme patients. But the problem still stands is that people don't know they even have Lyme. And they have all these autoimmune diseases, and your insurance is more than willing to pay for treatment of autoimmune disease. Insurance is not your friend. They make more money if you're sick than if you're healthy. They'll save your life. If you're going to die, they'll pay for it. They want to save you because if you die, they don't make any more money. But they never work to cure anything. It's always, let me treat this symptom, let me treat that symptom, let me put you on a biologic drug and knock down your inflammatory markers. They control inflammation. I speak to many doctors all over the world. I speak at research conference, and I always ask the question, why are people sick? Why do people end up with chronic disease? Why is chronic disease plaguing the world? And everyone wants to raise their hand and say inflammation. Like, no. What causes the inflammation causes the disease. We don't just focus on inflammation, but that's typically what our medical society does because they want you to feel better. They normally get in it for the right reasons. It's a great thing. Like, hey, I want to be a doctor. I want to cure people. And they quickly find out insurance pays for just enough to handcuff the doctor so they have to work within a algorithm or a protocol. Well, they want to help you. They are stuck with a few minutes to spend with you to just say, hey, this is the diagnosis I can give you, and here's the drug. Let me see you in 3 months. And you guys are aware of that. I'm sure I'll see out in your comments out there, my doctor only sees me for so long. But Lyme disease is ruining lives. And most people don't realize that Lyme is also sexually transmitted. It's rich in vaginal mucus and in semen. So if you've had intercourse with somebody unprotected, and maybe they're a hunter, a fisherman, they're outdoorsy, they've had ticks on them, you may have just got Lyme disease. And you didn't realize that was even possible. Oh, I'm getting sexually transmitted disease tested. Well, sure, but I bet they didn't test you for Lyme, and they definitely didn't test you for Lyme appropriately. With that said, Lyme disease, common things that I'll see on testing for people with Lyme's, obviously they'll have a lot of inflammation, but they'll also typically have low white blood cells. If you have low white blood cells or white blood cells below 5.0, you are immunocompromised, and that can be Lyme disease. If you have chronic Epstein-Barr, maybe your Epstein-Barr or mono that's chronic now is caused by having Lyme disease because it's inhibited your immune response, which has allowed Epstein-Barr to go out of control. All these things can cause chronic disease. They can cause you to have autoimmune disease and diagnosable conditions that your doctor's treating, and really it's just Lyme. I hope this has been beneficial. Let me see what you think in the comments. Definitely like and share, and we'll talk to you soon.